Hello and welcome to this week's edition of African Perspective. A very good evening to you. I'm Tshepiso Makwetla. Tonight on the program, we take a look at the Ebola crisis in Africa. News broke last week that the virus had crossed over to Uganda from the Democratic Republic of Congo. Uganda's Health Minister, Ruth Aceng, says there is no Ebola anywhere in the country, apart from that which was reported in Kasese in the country's west. She's told lawmakers in the East African country that after screening a blood sample 3 times, there are no more cases of the virus. Her reaction is in response to reports in the local media that there was a case of Ebola in Mbarara. This since the entry into the country of Ebola via its border with the Democratic Republic of Congo. 2 deaths were recorded there. Ssenyange, our correspondent in Kampala, Uganda, joins us now for the latest. Leon, let's just start with this latest announcement. What prevention measures are now underway, given that the government says there is no Ebola in the country at the moment?
Well, it's quite amazing how the turn of events here in Kampala are. Over the past few days, Uganda's President Yoweri Museveni met with the director of the World Health Organization. They have tried to iron out a few issues on how to deal with Ebola, and one of them therein is the bringing in of the trial drugs on Ebola. These will be coming in a few days, approximately 14, we have been told, and that at least is a measure that Uganda, the government and several of its partners are taking to ensure that this particular epidemic is contained. And now what the WHO says is that at least the vaccination of those that have been affected by Ebola is at about 97%. And this to them, of course, is a very good success. And that keeps the numbers down on those that have been affected. But as far as Uganda is concerned, yes, and from the cases last week, there's been quite a lot of sensitization of communities that are within the areas that are affected by Ebola. There's been vaccination of health workers and those that have been helping the Ebola patients. There's screening of people at several border posts. And yes, some of those are the things that have kept Ebola at least within control.
Just this suspected case in Mbarara, what brought about that suspicion that there could be other cases or people who'd been exposed to Ebola?
Well, the Ministry of Health has come out to disqualify any claims that there was any such case in Mbarara. Of course, this puts the situation now puts everybody on tenterhooks on how and what can actually happen. You can never know that maybe the neighbor next to you is showing any symptoms of Ebola, which fall anywhere between a fever, muscle pain, and anything of that nature. So yes, the ministry has come out to disclaim any such situation, and they insist that there is no case whatsoever of Ebola in Uganda, regardless of what happened last week.
And they've announced that they have a contact list of people who've either been exposed to or are at risk of Ebola. How are they going to work with this contact list?
Well, the Ministry of Health here says that it's very, very important to keep in the know of those that have been around people that have been affected by Ebola or even still have survived Ebola itself. Why? Because entirely it's one of those control measures in which you can have the disease prevented from spreading any further. How they are going to do that? Yes, there's a registry at every health center unit, registries at particular zones where people that have shown symptoms or have had relatives and have reported any similar cases are recorded, and of course telephone numbers, health workers keep in contact with them just to know how much further they are progressing. If any of them shows any signs whatsoever of Ebola, then of course they are withdrawn from the public and put within the isolation units. And yes, it's one of those ways in which Uganda has at least managed to mitigate the spread of Ebola.
All right, so earlier on, Leon, you mentioned the fact that clearance has been given to the Uganda National Drug Authority for these therapeutic treatments for Ebola patients. Do we know when they're expected to arrive?
What we have gathered is that the trial drugs should be able to come in within about 2 weeks. If that is anything of a long time, then either way it still should come in as a very much relief to the Uganda government. And like I said earlier, the World Health Organization has said that the success rate of survivors after the vaccination is at least of about 97%. So yes, there's quite a positive coming out of this. The trial drugs, what we have learned is that will come in four types: the antiviral and then the monoclonal, which either way will help in combating the situation.
And these are drugs that have been used and found to be effective in the Democratic Republic of Congo.
Well, not quite. They are trial drugs, so of course they come through as medicines that are helping one in the research to ensure that at least given any future occurrences, they could be the kind that they will be that they could fall back to in the treatment of Ebola. There's been a different type of medicine, at least that was launched in Uganda a couple of months ago. This has been the medicine that has been used for the health workers, vaccinated over about 1,000 health workers. So I think it comes in different trial elements. And yes, given the fact that if any of the types there can work, then it should be the kind that could be used for the future preventions.
All right. So you mentioned the World Health Organization earlier on. They're saying they're not calling it a global threat or epidemic, but there are reports suggesting that Kenyan doctors are testing a patient in Western Kenya. Tell us a little bit more about that incident.
Well, yes, just a few days ago, the World Health Organization declined to consider Uganda's situation as a public health emergency, but yes, with the claims that there was a suspected case in Kericho, then there could be something more to talk about. But the case in Kenya is a 36-year-old female. She had traveled from Malaba to Kericho, which is approximately 200 kilometers apart. She had gone to visit her husband, we've been told. She, however, she presented symptoms of Ebola. She was put into an isolation unit at the Kericho County Referral Hospital. The Kenya government has, however, come out to say that her results tested negative to Ebola. So still they're not throwing caution to the wind, regardless of the fact that she did not have Ebola. They're still on high alert, and they'll follow any whatsoever to ensure that they prevent any occurrence of Ebola, at least in Kenya. So
does that mean that there's a response team between the Uganda-Kenya borders and other neighboring countries bordering Uganda to ensure that they contain the spread should it occur in those parts, or even prevent it from occurring?
Well, Ebola at least knows no borders, and therefore at least the countries around the DRC, that is Uganda, Rwanda, Tanzania and Burundi, which they themselves have been classified as high-risk countries. Then, of course, those that are farther away from the DRC, like Kenya, or even Ethiopia and South Sudan, still will, of course, have any measures to ensure that the spread of Ebola does not occur. Now, of course, every country will try to ensure that they do the basics, which would be screening and having those that they suspect put in isolation centers and treated to ensure that there are no further cases that come through, at least within the contacts of the people that they have been able to separate. So yes, there's quite a lot of work going through. Uganda recently met DRC officials. Rwanda in itself is doing as much to ensure that no cases spread further to the south from the DRC. And like we've said, Kenya itself is trying to up its preventative measures by screening anybody, at least within the border areas, that come through, because even still there's quite a lot of people that cross from Uganda right into Kenya and vice versa, pretty much the same situation that occurs between Uganda and the DRC at the border point. So yes, the East African countries are not letting their guards down, and they're ensuring that at least Ebola keeps within its confines, but just as well controlled and not spreading any further.
A quick and final question, Leon. Any travel advisories that have been issued for people going into or out of Uganda?
Well, no travel advisories have been issued, but however, the ministry says that and has assured any traveller whatsoever that Uganda is safe and they can travel within Uganda and not be affected by the current epidemic. However, those on the western part of the country have to go through, like I said earlier, the basic processes of screening if they are at the border of Uganda and the DRC.
All right, thanks a lot for that, Leon. Leon Ssenyange, SABC correspondent, speaking to us from Kampala, Uganda. We'll be back shortly after this.